Well, good morning, everybody. This is, I believe, week 9 of our end of week webinar series, our speaker series featuring a variety of people who are ready and equipped to help you run your business through this pandemic crisis. And I want to start off by acknowledging that we are on the unceded territory, the Coast Salish First Nations, specifically the Tsuut'ina, the Tsuut'ina, and the Stonaz peoples. So we pay respect to those, our neighbors, and thank them very much for the ability to live, work, and play in such a beautiful place. My name's Kim Smythe. As I said, we're in week 9 of the end of week webinar series. And this week, we're going to be talking about WorkSafeBC. Our guest today is Laraine Ashpole. She is an employer's advisor with the Ministry of Labor. She has a long history of working with the Nanaimo Chamber, and I think that my very first luncheon about 7 or 8 years ago that I hosted, Laraine was guest speaker at that luncheon. So I'm happy to welcome her back. She's located in Courtenay and is a member of the Nanaimo regional team with WorkSafe. Her role is to provide independent advice, assistance, representation, and training to employers concerning workers' compensation losses. The role of the Employers Advisor's Office is independent from WorkSafeBC, and they advise employers on a confidential basis. They provide services at no charge and are funded by insurance assessment paid by employers. This is going to be a little bit different this week. Usually we have 2 guest panelists or co-panelists, and we go back and forth between them. But the wealth of information that Laraine has and the importance of WorkSafeBC to our restart and recovery process can't be understated. So I'm basically going to turn this over to Laraine, and she is going to take off and help lead us through some occupational health, safety, insurance information. So please, Laraine, it's all yours.
Thank you very much, and good morning, everybody. And it is a pleasure to be back with the Chamber. I think hopefully there's some of you that I've spoken with before. I've used the services of our office out of Nanaimo, where Cheryl and Daniel and Dee are located with me regionally. And also maybe, I think the last session I did for the Chamber was around bullying and harassment. I think we did a breakfast session. So very nice to be back. So thank you very much. With a little bit of support here, I'm going to go through a PowerPoint presentation. Marika did the benefit of actually sending you in advance a handout which consists of the 9 slides. So you should have that as a reference. I've broken this up into 3 areas, things that you may need to or want to know or should know relating to COVID-19 as it pertains to compensation claims, as it pertains to the assessments, the insurance premiums that you pay, and then a fair bit on occupational health and safety. And I'll just say in advance, this is evolving every day. And we're getting new information, we're getting new support through the Provincial Health Office, and WorkSafeBC is working very hard daily to provide resources and direction to employers in all those 3 aspects. So I'm going to give you what I understand to be some of the latest resources, but I really encourage you to become familiar with the WorkSafeBC website. And so I'm actually going to share my screen right now. And I'm going to start by showing you that website so that you can know where to reference. So Kim, can I just get confirmation that you can see the WorkSafeBC website?
Yes, it's visible to me.
Great, okay. So this is worksafebc.com. Many of you are probably quite familiar with it. It has all kinds of information, but what they've done is they've entered this section at the very top of the main page on all resources and links related to COVID-19. So I just want to point out that the template, some of the things I'm going to be speaking to, this is kind of your go-to spot. And what's really fantastic is they've actually also, through phase 1 and phase 2, they focused on your industries. So for those of you in healthcare or hospitality, you'll find some of the general information, but they've also tried to provide information that's specific to your industry. So I probably will come back to this right at the end, but I just wanted to draw your attention to it foremost. So what I'd like to do now is share some information. So once again, just a pleasure to be here today. As Kim has already outlined, our mandate actually falls under the Workers' Compensation Act. Section 352 provides the mandate of the Employers Advisor's Office, which is to provide that advice, that assistance, and that representation that our office does. There is also a Workers' Advisor's Office, and their mandate is to advocate and work specifically with workers and survivors around compensation issues. So we're a little bit broader than the Workers' Advisors, because from an employer perspective, you have issues related to claims, but also to your assessments, your insurance, how you're classified, what you pay, and then a huge piece around your occupational health and safety responsibilities. So our advice looks a couple of different ways. We have a duty advisor available every day, 8:30 to 4:30. There's usually 2 of us actually on, Monday through Friday. And at the end of the presentation, I provide the toll-free number for that. So you can call after today. If I don't hit your questions today, you can either contact me directly, I'll give that contact info also, or you can call the duty line to ask any questions. If it becomes something that you're going to need some ongoing assistance with, a little bit of coaching over a period of time, then you will be referred to work with an advisor in your area. So in this case, it would be myself, Daniel, or Cheryl that you would hear from, and we will continue to work through with you and assist you. The other big piece of our work, I would say probably 70–80% of our work, is actually representing you, the employer, in the review and appeal forums with WorkSafeBC and the Workers' Compensation Appeal Tribunal. And that takes the role of us representing you by writing written submissions or attending oral hearings. And so that's an alternative to legal representation or consultants where you would normally pay for that service. So what we encourage you to do is we say no charge for service. Really, you've prepaid it. So please access our services and save your money for the things that we can't provide assistance on. We are completely independent of WorkSafeBC, and we are confidential. The caveat to that is, which is really important, is we have full access to every workers' compensation claim file and also to all of your health and safety information. So we're in a good position to balance confidentiality of all parties, but also to kind of coach you in making some decisions as you manage WorkSafe issues. So below there is the link to our website that explains more of our services. If you don't already subscribe to our services, by doing so, you'll get a quarterly newsletter that keeps you really up to date on some of the regulatory and legislative changes and some that may apply to you. It's a great tool for your health and safety meetings. You'll also get notification of the seminars, the education and training. So another big part of our job is that we offer a variety of training on all topics related to occupational health and safety. So how to do incident investigations, how to joint committee responsibilities, managing claims, all those types of things. We generally, of course, have them in person and they're available to the public. And of course, with COVID, we've suspended those services. But check out our website because we're offering some webinars. One of them has been pre-recorded and it relates to COVID and the right to refuse unsafe work. And that might be something that you may be facing with some of your workers. So you might want to link onto there and listen to that pre-recorded webinar. We also provided one on more information related to claims that will expand on what I'm going to speak about today. And we also have some e-learning. So we have an e-learning module, which is general injury claims management that you may find beneficial. And again, hopefully by the fall, we're starting to look at ways to deliver our services in person. So let's start with insurance premiums, otherwise known as your assessments. Many of you already know that your assessments are based on the rate that's been assigned, and your rates vary depending on the risk and the injury rate within your industry or your classification. So Somebody in forestry is going to pay a higher rate than somebody who has a bookkeeping firm, just by virtue of the type of risk that they're exposed to. What WorkSafeBC is doing in terms of assessments at this time, that those of you that are on a quarterly account, you can defer your payments without penalty until June 30th, 2020. Those of you that pay on an annual account, you do not have to do your reporting or make payment until March of 2021. And those of you that are sole proprietors that have chosen elected for personal optional protection, or sole proprietors with workers, you can defer without penalty also till June 20th. The caveat to this is, as you know, you receive, customers of yours can receive clearance letters confirming that you're registered with WorkSafe and in good standing when your payments are up to date. Although you're not being punished for not being paid, be aware that it may impact your clearance status. So that's an important thing in consideration. And there is the link to reporting deadlines. I also would like to share that it was just announced in the last 2 days, I believe, that in addition to these arrangements, any of you that are participating in federal wage subsidy programs, you will not be charged premiums on those wages during this COVID period. So, and the other piece I want to say is these dates that are set to June 30th and March 2021, keep looking back, because depending on how COVID-19 proceeds, there is the potential of those dates changing and being extended. So just keep that link in mind when you're considering those. So that's what I have on assessment. In terms of compensation claims that relate to either traumatic or injuries in the workplace or occupational diseases, there's a couple of things that I'd like to share with you. So first of all, there is a link there about information related to claims. So there's a couple of things here. A, there are going to be those individuals who may file a claim for compensation because they believe that they contracted COVID-19 in the workplace. And this will go through a normal adjudication process the same way that the board has adjudicated other like H1N1 and other communicable diseases. In general, those that are diseases in the general public, even though you might feel them at work, are generally not accepted as compensation claims. But given the uniqueness of the circumstance, the board recognizes that there may be certain individuals in certain occupations that by virtue of their occupation, it's more likely than not that they did contract the disease in the workplace. So an example here would be frontline healthcare workers. The bottom line is it's not for you to decide. If a worker files a claim, a report of injury, because they believe and they have missed any time from work or lost wages or have sought medical attention treatment, you are still required to do the Form 7. What you may want to do is object your protest pending the board's closer investigation to ensure that they were actually exposed to it in your workplace. And the board has developed several categories where they call it the presumption. And so if you'd like to know more information about that, you're most welcome to contact me and I will provide you information. The board has developed a Q&A on contagious disease outbreaks that is available on their website. And there is claims policy around the adjudication of contagious occupational diseases. And it's practice directive number C4-1, but you can certainly follow up with me for more detail around that. So the long and short of filing some claims, it's up to the board to adjudicate, for you to provide as much information as possible, not to suppress persons from making those claims. And that there are some groups, categories, where the presumption will exist. So another piece I'd like to share that's related to claims is you may have workers right now that are injured and that because of COVID, you're unable to offer light duties or engage in a graduated return to work because of the environment, which means their claim is being delayed, wage loss, and as you know, claims costs impact your insurance premiums, similar to the more car accidents you have, the higher your car premiums are. So it's of concern to employers that are saying, wait a minute, this is no fault of my own, and this person can't access the light duties that I can offer and engage in a return to work. Similarly, my worker's not able to go to physio or not able to get the medical treatment or the surgery that they need because of the COVID, and why should I, bear the additional expense or delay? WorkSafeBC is looking into this. They are looking at ways to contemplate relief of costs for periods, but they have not come up with any definitive policy or guidelines or practice directives related to that, to my knowledge, as of today. But they do address it and acknowledge it on their website. So I've provided the link there for employers as it relates to claims. Oh, sorry. I think I hit the link instead of. Let's just see here. Okay. All right. Apologies. I've gone to my link instead of back to my presentation. Just a moment, please. Just going to re-pull that up. I apologize. Okay. Sorry about that, folks. There's my little bit of technology glitch. I'll also ask him if there's any comments or questions that you have as you go. You're welcome to put them to me now, or I'll make sure that we have time at the end of the presentation. So, sorry. Oh. Okay. All right, so I think I can come back here. All right, apologies there, everybody. Okay, so that is regarding claims. So now let's move on to the occupational health and safety, and that's the big piece that you're addressing right now with reentry or reopening or expanding your services, is around what are your responsibilities as it relates to occupational health and safety, protecting your workers. So a couple of things. I've made note there of the right to refuse process as outlined under Occupational Health and Safety Regulation 3.12. And that talks about the process that where a worker says, I'm not coming back, I don't feel safe, don't feel that you've put enough protection against the potential hazard of contracting COVID-19. And it outlines to you a very clear step process that you require. So without getting into too much detail, I'm going to give you an overview of that. And I'm going to ask you to check out our webinar on our website that was pre-recorded on how it relates to the right to refuse. So bottom line is, if a worker raises that concern, you have an obligation, a responsibility under the law to investigate and rectify. If you, and usually, hopefully it stops at that point. People are satisfied, okay, there's going to be sanitizers, there's going to be safe distancing, some of the things that you educate and work together on what needs to be put in place. If the worker continues to refuse, then you need to engage a health and safety representative, worker rep from your health and safety committee, or your worker rep that you have assigned if you have less than 20 but more than 9 staff, or another individual if you don't have another worker rep if you have under 9. And if you're still unable between the worker rep, the worker, and the supervisor or employer to come to consensus, then you can seek the advice of a prevention officer through WorkSafeBC. So I encourage you to educate yourself on the details of that regulation. The other thing that WorkSafeBC has put into place, and many of you might already be familiar with, is they've developed a safety plan tool. So this link is located here, and it's also on that main page of the WorkSafeBC website that I provided to you. And it takes you through a step-by-step assessment of the risks, of the hazards, of the different areas that you need to contemplate around how can you either eliminate the potential exposure, what are some of the administrative or systematic things that you can put into place, and some of the engineering controls that you might be able to consider. And then finally, what might be the personal protection equipment, PPE, that you're required to implement. So WorkSafeBC is requiring employers to do the safety plan tool. You do not need to submit it directly to WorkSafeBC, but you should complete it and have it available. And those of you that have health and safety, joint committee safety members or worker health and safety rep, you should engage them in that process as well. And of course, WorkSafeBC is taking the lead of the Provincial Health Office and the orders that are outlined there. So because things are evolving and always changing, I also encourage you to look at the website here for the provincial health orders, and those will help guide you in what are the parameters and the requirements for you to be compliant. So they've also provided, in conjunction with the safety plan, which prior to that they announced this, and this is sort of the things that you need to turn your mind to. It's a 6-step process around the steps you need to take in returning to safe operation. And what WorkSafe wants to see, or an officer, if they were to come out and visit you, is that you turned your mind to all of these things that you considered. And I would highly encourage, the most important piece here is documenting. So document how you came to your decision, what you based it on, what you put in place. And then another big piece about this is around the communication. So this is in terms of preventing people from refusing unsafe work. This will help you in terms of communicating out to your workers and your community, even your clients that come to your business, on the steps that you've taken and how you've turned your mind to it. And another nice handy tool that has always existed, because there's always the potential of exposure to all kinds of different hazards in the workplace. I've provided you with another tool here around preventing exposure in the workplace, and it's how to create an exposure control plan, and takes you through a risk assessment process. So and now I'm going to go back to the website and look at these a little bit closer, but I just wanted to kind of run through the sort of the overview first, and then we can open it up to some questions. I'll try to answer as best. So here's the information for our toll-free for a duty visor, and like I said, we're available 8:30 to 4:30 Monday through Friday. And of course, on the last slide, you'll have my direct number, and going forward, you're quite welcome to phone me or send me an email, and I'll be happy to talk with you or send you what resources. There's mention of the webinars that we provide on the right to refuse and information around claims. And the other thing to be aware of right now, I'll just give a little plug, is you may be aware that after April of 2017, you must have mandatory training for any new joint committee member. So we have consulted with WorkSafeBC, and on the WorkSafeBC website is a 2-hour introduction to that mandatory 8-hour training component, and we are offering a balance through a series of 4 90-minute webinars. And in total, the board is accepting that as meeting the requirement for 8 hours mandatory training for new committee members. And the reason I mention these things, as well as I mentioned earlier, the online learning about managing e-learning on claims management, is you're doing work differently. And some of you might be looking for ways to give staff tasks and an opportunity for education and learning because they're not doing their normal duties and activities. And these are all important um, pieces of your business. So there's maybe actually, I know you're focused right now on the initial um, reopening, but there might be an opportunity here for you to spend some time on developing your internal occupational health and safety program and take advantage of this time to where people are looking, you're looking for tasks for people that they could do these things. And again, our seminars are listed on our website, and they'll come back into play hopefully in the fall here. No guarantees, but we look forward to that. And then again, there was the quarterly newsletter. Also, if you subscribe, you'll get the law and policy bulletin. So our law and policy manager does a great job at any time there's a significant change, as with the new joint committee training requirement or bullying and harassment. She develops law and policy bulletins that kind of take all that legalese and put it into a language to help you understand what is it that you're required to do, and provide you with that resource. So there's my contact information. I understand that you would have received this in the handout, and that it'll be available afterwards. So what I'm thinking is, Kim, if you like, if there's any questions, if you'd like to open up the floor, and then I've also we'll go back and some of the websites to offer some resources. I can't hear you, Kim. I think you're on mute.
Yeah, thank you. Lips moving, nothing happening. There are no pressing questions at this time, so if you wanted to continue on, and
Sure.
I see that you've got posters here for hand washing, occupancy limits, etc. So maybe just flip to that.
Sure, let's do that. So I'll go to those. So that's the other thing, is don't feel that you need to recreate what's already available to you. So there's a couple of places, absolutely, on the WorkSafe site. So I'll take you to these posters. They've got the hand washing, the occupancy limits. You can print them off in color, fill in your own information. And so they're trying to give you as many tools as they can to make it easy. The other thing that is really a great resource are the health and safety associations. So I know, for instance, BC Municipality Safety Association is a fantastic resource, and many of the resources on their website you do not need to be a member of to access. And because they're a municipality based, they tend to be quite general. So you may find that to be a good resource. If you're part of the BC Construction Safety Alliance, if you're part of BC Forest Safety Council, if you're involved in a tourism association, any of those types are making an attempt to provide resources specific to those industries. So let's go back to the website here. So here under the COVID section here, I'd like to take you to have a look at the COVID safety plan template. So some of you may be familiar with this. And all of the items too, I'll just share, are offered in a variety of different languages. So that's a great option that they provide. So this is the example of the safety plan, and this is taking you through those different steps. So really key pieces around step one, assessing the risks at your specific workplace. And they've actually provided, which is really handy for you, is a bit of a checklist set up. So you can actually go through and be able to say, in this example here, we've involved frontline workers, supervisors, and joint health and safety committee in the process. You've identified areas where people gather, such as break rooms, production lines, meeting rooms, specific job tasks or processes, certain tools or machinery or equipment, and surfaces that people touch, which is a big one. So I think what's really great about this tool is it's going to turn your mind. You don't have to put the pressure on yourself. Am I going to think of anything if I'm going to miss it? And what often the great thing about using the WorkSafeBC templates is they base any of their tools on the regulatory requirements. So you don't have to wonder if, by creating your own checklist, you can you can rely on it being based on what you're going to be held, the standard that you'll be held to. And then the second section looks at, after identifying and assessing the risks and the hazards, implementing the protocols to reduce those risks. And so they provide links right in this template, and I mentioned earlier around the industry-specific protocols. So whether it's restaurants or healthcare, those types of environments. And also that they've also provided the link under the orders and guidance, as I mentioned, that comes through the provincial health officer. So this is, you may have heard me use these terms earlier in my presentation, and many of you that have done risk assessments or investigations in the workplace, you might be familiar. But this is actually sort of the theory behind addressing any potential hazard in the workplace, is that regulations actually require you to turn your mind to, can you actually eliminate level of protection? So this might be where eliminating, a good example here would be curbside pickup, eliminating people even coming into the store in the first place. So you've eliminated that entirely. Engineering controls tend to be the things like the plexiglass, the no-touch payment, things that you can put in place that reduce the exposure. These are systems. And then you've got administrative. So this, where your administrative control would be using those posters about limiting the occupancy side. The rules, the administrative, the system, the rules that you put in place to reduce the exposure. And then the final, and of course, very much a part of what we're experiencing today, is around the PPE. So whether that's the masks or latex gloves, or in some environments, they're using full body coverage. My partner's in restoration, and when he goes out and is exposed, there's going to be a client in a home, they're wearing full body suit, the full-on masks and hair nets and the whole shebang. So these are examples of what I was giving when it comes to elimination. Engineering. Administrative. And the using masks. And again, back to the potential of workers not having confidence and refusing unsafe work. It's really important if you can document this and show this. A, they're less likely to, because they're going to understand. So training is another big piece of this. And all these areas that are highlighted in blue are additional links for you. So related to cleaning and disinfecting. And actually, I had a client yesterday I spoke to, and he brought up a really good point. There are some really ingenious companies out there that are changing their business practice to go from maybe distilling gin to making hand sanitizer. But there are requirements that come with that in terms of safety data sheets, so that you're understanding what are the ingredients, what are the potential hazards of the exposure to that. So just a heads up to you to think about that next layer. The things that you put in place, you then have a responsibility to train people on how to wear that mask effectively. I don't know how many you have seen on TV, the people that are wearing the masks and leave their nostrils and nose out and just cover their mouth. So are you giving instruction? Do you understand? And then if you're using cleaners, chemicals, you need to follow the WHMIS requirements. And so there's a whole section under the occupational health and safety regulations that you can refer to around women. Okay. And then here's the piece around your policies. And a big piece about this is going to be about communicating, with your staff and notifications even to the public around people that potentially have been exposed or need to self-isolate. Now, here's another good one. How many of you maybe have workers, or you yourselves are working at home? So that doesn't preclude you because of COVID-19 not to have working alone policies and working from home policies. So about halfway down on this checklist, you'll see that there's a link to them. So you should have already, if you have workers that work from home in isolation, prior to this, you should have policies. So my example is I remote work pretty much full time from my home. And I have a policy that existed prior to COVID-19 where I do a check-in with my supervisor. In the morning, we also have a check-in board electronically, but I check in with him as well. And that if I'm going to leave for any period of time, if I'm going to take a half an hour lunch and go for a walk, that I'm letting him know when I've left the building and that when I'm back. So this might be temporary for you or permanent, but you still are required to have some policies. And then the other things to think about, if you've got workers now that you've changed your work practice, what are the ergonomic things? So we're looking now and wondering about people being injured when they are at home ergonomically because they're hunched over the dining room table with their laptop. Not all of us get to sit like him in the forest. But people are doing things. The other thing I want to caution you about is if they haven't been used to doing their normal tasks, we see people come back to work and all of a sudden they're working on the line or they're working in repetitive motion, strenuous, and that's when may see an uptake in those types of sprains and strains, overexertion, overextension type injuries. So also keep in mind down the road that when people are returning to work, how are you engaging them back into their tasks and jobs so that they are going to be safe? Okay, so there's also, as you see, links. I'm just going to go along here. Links to the BC COVID self-assessment tool. So that's a handy thing to have available to yourself and your workers. And then the step 4 of this, of course, is around that communication plan and training, which I've already been talking about. And then monitoring. So things are changing. This is evolving. And so we are really so fortunate in British Columbia, and especially on Vancouver Island compared to so many other countries or communities. But there's always the potential of a slide, and they've already cautioned about the potential of sort of a second wave. So don't become complacent. Stay current. Monitor the information, and keep the communication happening with your health and safety committee and all of your staff. And there's a little concern, a little alert here around making sure that when you create this plan that you're not identifying personal information. But I do want to speak to personal also for a minute. So you are going to look at things in general, how to keep your workers, and I know many of you are also contemplating your customers or clients, but of course Workers' Compensation Act and the OHS regulations are directly related to your workers. So although you're looking at general practices, you also need to know your people. So if you have people that are in the higher risk groups, potentially emphysema, other pre-existing medical conditions, age, whatever those may be, you may be engaging in different plans for different people depending on those circumstances. So just to keep in mind that personal aspect, that all of you are responsible for addressing the health and safety of your workers, and not every plan is going to fit everybody entirely. So there may be people that are refusing to come back due to unsafe work, and when you actually investigate it, that's not what it is. It's that they have a pre-existing health issue, or they're living with somebody that does, and that their fear of if they contract it, what that impact will be. So that's a different process, and they may be entitled to access federal benefits through the emergency programs that are available if they can't come back to work for COVID-related reasons. That doesn't make it a right to refuse unsafe work necessarily, but unless you go through that process, you're not going to discover that information. So there's no direct hazard to them, and they have choices to make. And that's the same around persons that, if they intend to file a claim for compensation related to COVID, it's around assessing and determining are people actually accessing the right program and services. Okay, so let's go back to any other questions yet, Kim? I must be.
No, there hasn't been, other than I think we're having a problem. You might want to refresh your screen share, because we don't seem to be getting beyond that first resources slide.
Oh, okay. So you haven't seen the WorkSafeBC? Have I been on the WorkSafeBC?
What I'm seeing is a resources page, and nothing has refreshed since then.
Okay. Is that working?
We now have the WorkSafeBC website in front of us.
Okay, all right. So that's I'm sorry, I didn't realize that. I've just taken you all through the COVID safety plan template. And so now I'll just go to that link quickly, and I won't go over it again, but this is where you're going to go to, and all that information that I just went through in terms of the 6 steps that you need to go through that will provide you with a bit of a checklist. That's the resource that you're looking at.
Okay, awesome. So folks can go directly to that site and refer back to everything you've just spoken about. And if they're going to be watching this later from our Facebook site, from our website, or from our YouTube channel, then they can again be reminded that the references you were making was to this COVID-19 safety plan page.
Exactly, and it's located on the main page at www.worksafebc.com. So all of those resources are there. So I'm hoping some of you have already been to this site, and others are maybe, if you're seeing it for the first time, you can see the potential of all the resources that are available absolutely around COVID-19. But you know, sometimes many of you are very busy business owners, small businesses, may not be aware of your occupational health and safety responsibilities. So I invite you, when all of this is passed, if you haven't accessed our services or you'd like to know some information, we offer a fantastic resource that comes through WorkSafeBC, and it's a small business occupational health and safety guide, and it helps you develop what's the bare minimums, or what are the requirements that you need for an effective health and safety program. So I'm happy to be a resource for post-COVID-19 health and safety. So I think that what I tried to do today was put together information without getting into too much detail to help you sort of navigate. It's hard to know what everybody is requiring. If you have specific questions, please do contact me directly about your specific workplace. Sometimes it's a challenge when we do these types of forums, because we don't necessarily want to share individual or private circumstances. So you can absolutely call any of our advisors for some confidential advice.
Well, thanks so much, Laraine. I just a couple of points that you mentioned that I wanted to emphasize again here was the confidentiality of your service, the fact there is no fee for the service. I think that's super helpful information, because there's so many questions that we all have about getting people back to work, getting them back to work safely, and providing safety to our customers and clients as they come through our door. Um, Especially like you pointed out, the right to refuse unsafe work webinar, um, pointing out the deferral of premiums is really important as well, of course, and a COVID operating policy on hand at all work sites. I know that we've drafted one for the chamber, and I suspect that what we'll need to do now that we've kind of whipped it out of the air is go to the WorkSafeBC site and make sure that we have covered off all the necessary points there. What I found super interesting, and didn't even give thought to prior to our conversation today, was policies on working from home and remote working. Would have never thought that me sitting at my dining room table, I need to have a COVID policy for that, because that's been my work site for the last 75 days.
Yeah.
I want to draw people's attention to the fact that it's a great time to have an airplane go overhead, by the way. I'll just give this a second to pass. I wanted to point out that there's a number of chamber members in the business of helping folks through COVID-19 and other similar instances. If you go to our member directory online, nanaimochamber.bc.ca, you'll find a member directory there, and many businesses listed in the hazardous materials area. And there's a small company who is specifically working on COVID-19 risk and returning to work. That's Scott Lisak at Carbon Safety Solutions. And Carbon Safety Solutions works on providing hazard and risk assessments, guidance on best practice expectations, support for development and update of safety documents and programs, so that's just what we're talking about, and ATP, microorganism testing to identify good cleaning practices. So to really get into it, I'd invite people to look up Scott on our member directory and send him an email. And I know that numerous businesses are going to have to go through a deep cleaning process before they reopen safely. I think that about wraps it up for this week. Thanks so much again, Laraine.
You're
Wealth of
welcome.
information. And I think we, by keeping it at 45 minutes, we prevent the information overload from happening.
Good. All right. Well, I look forward to hearing from everyone, and wish you all to be safe and have a good weekend.
All right. Next week, the subject is community safety and social order. I can't mention the names of our two co-panelists next week. That will probably be out on Monday or Tuesday. But if they're both available to show up for this and can confirm that, I promise you it'll be a super interesting discussion, as they are both very high-level individuals in our community, focused on safety, social order, and a good, healthy community. So thanks everybody for joining us again this week. Have an awesome weekend, and we'll see you all next Friday. Bye for now.